estimates from the organization indicate that non-communicable diseases remain a leading global health challenge, responsible for 75% of non-pandemic related deaths worldwide in 2021. The WHO further reports that low and middle income countries continue to bear the heaviest burden, accounting for 73% of the NCD-related deaths, primarily due to cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. In Ghana, the situation remains critical. NCDs account for approximately 43% of all-cause mortality, with a significant rise recorded between 2012 and 2023. Today, they rank among the top 10 causes of death. Alarmingly, individuals aged between 18 and 45, the most productive segment of our population, constitute over 50% of the NCD cases, impacting both public health and economic productivity. Facility-based data from our 3 teaching hospitals show that the average annual treatment cost for NCDs is approximately 53,000 Ghana cedis per patient. This financial burden severely strains households, with over 60% of affected families facing catastrophic health expenditures. Furthermore, individuals diagnosed with chronic diseases have a 75% likelihood of falling into poverty within 5 years. Those battling kidney and cardiovascular diseases in particular spend between 70 to 95% of their total non-food expenditure on healthcare, a clear indication of a devastating economic toll. Such a situation poses serious risks to public health and demands urgent attention. It must not be ignored. Swift and decisive action is crucial to mitigate its impact and safeguard the well-being of our communities. The Ghana Medical Trust Fund, the Mahama Cares Initiative, offers a transformative opportunity to protect lives, preserve dignity, and strengthen our health system. A recent survey involving over 3,300 Ghanaians reflected strong public endorsement of the fund. 79% of respondents deemed it necessary, and more than half expressed willingness to contribute monthly. The overall objective of the fund is to mobilize resources to finance and support the treatment of non-communicable diseases. It focuses on covering the cost of treating chronic conditions, including cancers, diabetes, hypertension-related complications, cardiology issues, chronic kidney failure, and stroke at the specialist level. Support will be selective, targeting the gaps not currently covered by the National Health Insurance. In addition, capacity building initiatives are being pursued to expand access to specialist care with a strong emphasis on early screening and diagnosis. As a ministry, we reaffirm our unwavering commitment to achieving universal health coverage for the people of Ghana. Ghana Medical Trust Fund aligns strategically with our key sectorial policy frameworks, including the National Health Policy 2020, Ghana's Roadmap for Attaining Universal Health Coverage 2020 to 2023, 2020 to 2030, the Essential Health Services Package 2022 to 2030, and the National Policy on Non-Communicable Disease 2022. We pledge to ensure the full implementation of this visionary initiative, enabling the people of Ghana to reap its maximum benefits under the inspiring leadership of His Excellency John Dramani Mahama. Your Excellency, ladies and gentlemen, today also marks the achievement of 3 major milestones in the establishment of the Ghana Medical Trust Fund. First and foremost, the task force integrated to guide this process has successfully completed a comprehensive policy document detailing the operational and management framework of the fund. Secondly, the draft bill for the establishment of the Mahama Care Fund is now ready and will be submitted to Parliament immediately after the recess. Most importantly, as the primary obstacle, the capping of the National Health Insurance Fund has been removed. This significant development has unlocked substantial resources, ensuring that a dedicated allocation of funds will now support the full-scale operation of the Mahama. These developments demonstrate our seriousness of purpose and task for health. Express my heartfelt gratitude to His Excellency John Dwayne Mahama. Said I appreciation go to the test of the bill and the dedicated staff of the organization of visionary project. Finally, presented in the national survey and expressed their unwavering support for this life-changing initiative. Your voices have been instrumental, and I assure you that we remain fully committed to serving you with dedication, placing your needs at the very heart of our works. And I quote, when we invest in NCD financing today, we ensure a healthier and well. Officer, I am very free.
Your Excellency, President Joe Dwayne Mahama, my very good friend. Distinguished ladies and gentlemen, it's a great honor. Yes, our report. You will find data. You will find lives. This story is getting the short comes. And so the old man, God has written and thanks banner your friends and families to give. We'll rejoice, we'll have hope, so that they can get back. In Genesis, and then or obey the command of our Lord Jesus Christ. Love has no man than this, that the man laid down his life for his friends. John 15. May I humbly ask the members of the task force stand. I could sleep soundly because they were there to work morning, afternoon, and evening, and midnight. Thank you all very much. God bless you.
Members of the Parliament Select Committee on Health, also we are told you did a good job on this. We also have members of the Ministry of Health, the Ghana Health Service, amongst others. And of course, I must also say that we are live everywhere, courtesy the Minister in charge of Government Communications, Phyllis Kwachiofusi, is also in our midst. At this point, we'd like to take remarks, brief remarks from carefully selected groupings. We'll take first off from Professor Richard Adanu. He's a rector, Ghana College of Physicians and Surgeons. Please, let's welcome him.
Mahama, the Honorable Minister of Health, Honorable Kando, observing all the protocols that have been well established by the Minister of Health. I thank the organizers of this gathering, this historic event, for asking me to speak briefly. I'm here on behalf of the rectors of the postgraduate specialist training colleges to say that, just like Honorable Professor said, His Excellency has brought the baby out. He's created the legal environment for this Mahama Cares initiative, and the task now falls on us as heads of the agencies of the Ministry of Health to make sure that this works. So I'm here to say on behalf of all the heads of agencies that we are committed to making sure feel the full benefit of this. I'm here especially representing the postgraduate medical colleges as we to provide the leadership. And many people appreciate the work of specialist doctors and talk about that, nurses and specialist pharmacists too. But then I would like to just let all of us know that we need specialist nurses, we need specialist pharmacists, and we need specialist doctors to make sure that this is delivered. This is not a thing that is done only by doctors, it's done by the whole healthcare force. And whatever is being done to make this initiative work should not selectively choose some members of the healthcare force. It should cover everybody equally. Having said that, I'll talk about what I know. We at the Ghana College of Physicians and Surgeons have done some analysis, and we've realized that we need about 6,500 additional specialists for us to be, of all categories, for us to be able to deliver the kind of care that is needed by 2030. Currently, we have about 2,000 specialists in training in the country. So there's quite a bit of a gap. However, mathematically, we can actually halve this gap if all regional hospitals in the country are fully delivering postgraduate training. And would like, Your Excellency, now that we have your ear, to ask you to lean on the Minister of Finance, and all other people involved to make sure that this is delivered during Mahama Chapter 2. We believe that it is possible in 4 years to have all the regional hospitals fully delivering a certain set of postgraduate programs. And if we do that, we can increase the number of specialists in training currently from 2,000 to 3,000. I mean, that's a 50% increase, and that would be very good. We would like to have all hospitals equipped with mini simulation centers. I mean, in other words, labs where they can go and practice on how to deliver their services and not necessarily practice straight on patients. And then, in addition to that, have 4 simulation centers over the whole country. We currently have 2. There's one here at UGMC, there's one at University of Health and Allied Sciences. And if we deliver 2 more, Your Excellency, we will fill this country with specialists. So I asking for the support of your government and your office to get this to happen. And have no doubt at all, we are fully committed to delivering this initiative. You have created the appropriate legal environment, and we are committed to working
like to invite Corporate Ghana, of course, because of their immense contribution that we're expecting from them. I think that this applause should be actually bring down the roof at this point. Please, ladies and gentlemen, let's welcome the corporate banking head for CalBank, Kwejo Arize. He will be actually speaking on behalf of Corporate Ghana. Kwejo Arize, please, let's do it once.
Good morning, Your Excellency. Good morning. Good morning, our Minister of Health, and good morning, ladies and gentlemen. Good morning. All protocol is observed based on what's been said already. So I stand here representing Corporate Ghana, and we work with people. And I indicated that everybody here is an employee, with our chief employee sitting. And if we don't take care of our people, we think that we're not going to be able to achieve our objectives as Corporate Ghana. This morning, I just want to draw the attention of Corporate Ghana to the need to support a healthcare that ensures that our objectives as an institution, whether in mining, in finance, in healthcare, in oil and gas, in whichever sector, is achieved. We can achieve that through working with people and ensuring that our people have good healthcare. We believe that the Ghana Medical Trust Fund is the right thing to support. It's the right policy to support. And we employing every corporate head, every institution to ensure we come to the party. This is not a one-time support requirement. This is supposed to be a lifelong activity that we all commit to. We can make it work if we all put our hands to the wheel. So I'm here calling on the support of all Corporate Ghana and everybody, every institution in and out of the country to put our hands to this to make it work. And I believe that with our over 14 million workforce from formal sectors, informal sectors, if we support this health policy, we can get the benefits and the country will be a much wealthier country with a healthy people. Thank you.
Group Head, Corporate Banking, Kwejo Arize, thank you. And I see leadership of MTN here as well, so I'm sure that they're also committing to this. And if the applause you gave earlier for Kwejo was not good enough, I'm sure you know it was not. It's time to hear from our development partners. And this time, promise you're going to do it louder for them. Please, let's welcome the sector lead of the development partners in Ghana, the Chief of Health, UNICEF, Manuel Dewez. Is that all you can do?
Your Excellency, the President of the Republic of Ghana, John Dramani Mahama, Honorable Minister, heads of agencies and directors, members of parliament, distinguished guests, and standing on existing protocols. On behalf of the Health Development Partners, allow me to congratulate the Presidency, the government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development partners, who aim to ensure Ghanaians have access to quality healthcare services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent exposure to key risk factors such as tobacco and alcohol abuse, and healthy diets and physical activity. Furthermore, there's a lot of evidence that support the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking.
Well, at this point, it's time to bring it to many things that it is associated with just the agent, but nowadays more and more persons are finding themselves hitting. I have in our midst this morning a mother and a daughter who are both living with diabetes. Ladies and gentlemen, it's time to hear the story of Janet Ashibu. Please welcome her with a round of applause.
President